Imagine standing up from your bed in the middle of the night. You take one step, and suddenly the room starts spinning. You reach for support, but you miss. This happens to thousands of older adults every single day, and in many cases the cause isn't weakness, it's blood pressure that's too low. A recent study published in the Journal of the American Medical Association followed more than 15,000 seniors over 5 years. What they found challenges everything we've been told about ideal blood pressure. Those with so-called perfect numbers, around 120/80, had a 28% higher risk of serious falls. And surprisingly, their overall mortality rates were higher than those with moderately elevated blood pressure. In the next few minutes, you're going to discover the exact blood pressure range linked to the longest survival in older adults. Why pushing numbers too low after age 75 can be dangerous, and a simple test you can do at home tonight that could prevent a life-changing fall. Before we go further, I want you to do something simple. Drop a comment with your age, just your age. And if you've ever felt dizzy when standing up, add the word dizzy, because what I'm about to explain affects people very differently at 65, 75, and 85. Here's what's happening in clinics every single day. A 78-year-old patient walks in for a routine checkup. Their blood pressure reads 145/86. The doctor looks at the guidelines, target below 130, and immediately prescribes medication. One drug becomes 2. 6 months later, the numbers look perfect, 124/78. Everyone celebrates. It looks like a success. But here's what nobody checks. That same patient gets up at night to use the bathroom, and within seconds, their blood pressure drops to 88/56. Their brain isn't getting enough blood. The room spins, balance disappears, and suddenly, we're not talking about blood pressure anymore. We're talking about a fractured hip, emergency surgery, loss of independence. Here is the truth most people never hear. For decades, we've believed one simple rule: lower blood pressure equals better health. And for people in their 40s and 50s, that's largely true. But after age 75, something changes. Research now shows that older adults with systolic blood pressure between 130 and 145 actually live longer than those below 120. They experience fewer falls, fewer fractures, fewer hospitalizations, better cognitive function. Meanwhile, those with perfect numbers often face dizziness, fainting, syncope, kidney problems, higher mortality. That is not fear-mongering. That is medicine. So why does this happen? Because your body at 75 is not just an older version of your body at 45. It's fundamentally different. First, your arteries become stiffer. Think of an old garden hose. It doesn't expand easily. Your body actually needs slightly higher pressure to push blood effectively to your brain. Second, your internal pressure sensors, called baroreceptors, slow down. When you stand up, they don't react as quickly. That delay can cause a sudden drop in blood pressure. Third, your body processes medications differently. Drugs stay in your system longer, act stronger, and can push your pressure too low without warning. Let me break down the research clearly. In a study of over 15,000 adults aged 75 and older, the lowest death rates were in people with systolic pressure between 130 and 140. Those below 120 had a 28% higher risk of serious falls. Their overall mortality was 14% higher. Those above 150 had increased stroke risk, so the safest range, not too low, not too high, right in the middle. Now imagine this. You're 76 years old. Your blood pressure is 142/84. Your doctor wants to lower it to 120. 2 months later, it's 128, then 122. Everything looks perfect, but something feels off. You stand up and feel lightheaded. The room tilts for just a second. You mention it, but you're told it's normal. What's actually happening is this. Your blood pressure might be dropping from 122 to 95 the moment you stand. Your brain is repeatedly undersupplied with blood, and no one notices because your sitting numbers look great. Now here's the most important part of this entire video. There is a simple test you can do at home tonight. It takes less than 3 minutes. It's called the orthostatic blood pressure test. Here's how you do it. Lie down and rest for 5 minutes. Measure your blood pressure while lying down. Stand up immediately and measure it again. Now compare the numbers. If your systolic pressure drops by more than 20 points, or your diastolic drops by more than 10 points, that is a red flag. It means your blood pressure may be too low for your body, even if your normal readings look perfect. So what should your blood pressure actually be? Here's what current research suggests. Ages 65, 74, around 130, 140, ages 75 to 84, around 135, 145, age 85 plus, around 140, 150, And your diastolic, the bottom number, should generally stay above 65, ideally between 70 and 85. These are not strict rules. They are starting points for a conversation with your doctor. Here's something most people don't realize. Blood pressure changes throughout the day. One reading means very little. That's why home monitoring is so powerful. It shows your real average, not just a snapshot in a clinic. So what can you do starting today? Monitor your blood pressure daily for 2 weeks. Perform the standing test at home. Pay attention to symptoms like dizziness or fatigue. Talk to your doctor about personalized targets, not generic ones. Speak up if medications make you feel worse. Here's what you now understand that most people don't. Blood pressure is not one size fits all. For older adults, especially over 75, too low can be just as dangerous as too high. The safest range is often slightly higher than expected. Preventing falls may be more important than chasing perfect numbers. If this information opened your eyes, I want you to comment one word: informed. And if you know someone over 65, share this with them. You may protect them from a life-changing fall. Subscribe for more evidence-based health insights that most people never hear. Stay safe, and I'll see you next time. This content is for educational purposes only and is not medical advice. Always consult your healthcare provider before making changes to your treatment.